all of you to come over here to listen to our story, basically. So, Kannadallu ಮಾತಾಡ್ತಿದ್ದಾನು ಏನಾದರೂ if you want any other information ಕನ್ನಡದಲ್ಲೂ ಮಾತಾಡ್ಬೋದು, it's not a problem. So, some of the medical words ನನಗೆ ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡೋದಕ್ಕಾಗೋದಿಲ್ಲ, so I just have a little bit of mix of both. And to be very honest, ನಾನು ಈ ವಿಡಿಯೋ ನೋಡೇ ಇರಲಿಲ್ಲ. This is the first time I am also seeing the video. And ಇವತ್ತು ನಾನು ಇಲ್ಲಿ ಬಂದಿರೋ ಉದ್ದೇಶ ಏನು ಅಂತಂದರೆ, I wanted all of you to know the story of one of the baby girls. Baby girl ಅನ್ನೋದು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ಇಲ್ಲಿ. So I'm going to stress that point because we know that there is a high amount of female feticide. Sex ತಿಳ್ಕೊಂಡು ಬೇಬಿಗಳು, if it's a female or a baby girl ಅಂದರೆ people are aborting it, right? So ಆ ಒಂದು ಸನ್ನಿವೇಶದಲ್ಲಿ ಆ ಥರ ಒಂದಿರೋ ಎನ್ವೈರನ್ಮೆಂಟಲ್ಲಿ we are able to save a baby girl who's born almost about 300 kilometers from Bangalore. So I would like to thank Motherhood CEO Mr. Vijayaratna and the entire team for giving us this opportunity basically. So now I got trained completely in England, and then coming back here I wanted to replicate what we do there. And you need opportunities also, you need resources also. There is the ambulance that you noಡ್ತೀರಾ ಅದರೊಳಗಡೆ baby ತಗೊಂಡು
at Motherhood Hospital, Bangalore. This case is about a baby who was delivered almost about 250 kilometers away from Bangalore in Andhra Pradesh, and this baby was noted to have a very racing heart, very high heart rate of about 250 to 280 per minute. Normally a newborn babies would have a heart rate of around 120 to 160. So this heart rate being so high is called supraventricular tachycardia, SVT in short. So a babies, when their heart rate is going so high for a long period of time, they can have heart failure, and then the heart will fail to pump the blood, and then a lot of these babies can die. The treatment for this is medical treatment. You are giving medications called adenosine. In some cases, if it is not treatable with that, you keep giving more medications, for example amiodarone, beta blockers, flecainide. So there are a lot of other medications that can be given. In our case specifically, what happened, the baby did not respond to any of the medical treatment. So we waited for a little bit longer for the medicines to work, only because the baby's heart was good and functioning well. By second day onwards, we started noticing the heart was actually failing. The ventricular contractions were becoming weaker. So this is a time where we have to step in and then gave what is called as a shock treatment for the baby. So we administered 3 doses of shock treatment, and in spite of that, the baby's heart did not come back to normal. So when we give a shock therapy, usually the heart will stop for a fraction of a second and it will restart. It is like booting the computer basically. So when the heart restarts, generally it will go back to normal rhythm. So in this case, it did not go back to normal rhythm. So this is when there is a baby where you have tried a lot of medical treatment, you've tried giving shock to the baby, and heart is not functioning well. This is when we had to go out of the box and then think about a novel therapy which can be used in order to save the baby. So this is when we administered a therapy called total body cooling, where the baby's temperature is brought down to about 33.5 degrees in order to make sure that the heart rate comes down. So by God's grace, it did happen. 4 to 6 hours after starting the treatment, the heart rate started getting better, and all the rhythm came back to normal rhythm. And we had to maintain this for some more time and make sure that the heart goes back to normal function. Then we started rewarming this baby very, very slowly, because if you're starting to rewarm, sometimes the rhythm will come back to the SVT. So luckily that did not happen. And then once we stopped the therapy, the baby's heart was functioning normally, and it had a normal heart rate of about 130 to 140, and then the rhythm of the heart was also normal. And then the baby was maintained on 3 medications for a period of about 1 month, sent back to where it came back from. and had a connection with the doctors there, continued the medical treatment in Anantapur, that's where the baby came from, and then made sure after 1 month we stopped all the medications. So we reviewed the baby after about 6 weeks. We repeated the ultrasound scan of the heart, and we were very, very happy to say that the heart was functioning normally, and then the rhythm was also normal. And this baby girl was a bundle of joy to actually look at.